Okay, this is the cardiac arrest management with AED skill sheet. This is a national skill sheet. There is no state skill sheet for cardiac arrest and AED. So this is the one that you'll be using in class and for testing purposes. This is Efren, and he will be going through the skill for you.
All right, so the first thing you'll do is your BSI and PPE. So you'll say BSI PPE, then you ask about scene security. So is my scene safe?
It is.
And you're going to question the bystanders about what happened prior to your arrival. So did anybody see what happened leading up to your patient's collapse? After that, you're going to check your patient's responsiveness. So say, sir or ma'am, can you hear me? You'll shake them, do a sternum rip, something like that. Then you're going to assess their breathing and pulse at the same time. So you'll check their carotid pulse and then look for chest rise. And if there's no chest rise,
The evaluator will tell you that the patient is either apneic, so not breathing, or they have agonal breathing, which is gasping breaths, a couple every minute, and your patient is pulseless, no pulse.
okay. And then if they're pulseless, you'll immediately start compressions, and you'll request for an EMS response. So you'll ask a bystander to call 911.
So as he's doing his compressions, the things that we're looking for, he's doing the correct compression to ventilation ratio, which is going to be 30 compressions and 2 ventilations. The chest compressions, we're looking for adequate depth and rate. So he's compressing down the 2 to 2.4 inches on the chest, or about half the depth of the chest. His hand placement is correct. The lower half of the sternum above the xiphoid process, so not too low, right around the middle. And then when he's doing the ventilations, we're looking for proper rate and quality. So he's doing 2 ventilations after 30 compressions. We're looking for chest rise. The other thing that we're looking for when he's doing compressions is that he's letting the chest recoil or completely come back up before he starts his next compression. We're going to monitor for about 2 minutes or 5 cycles of 30 compressions to 2 ventilations. When he's on about his 5th cycle of compressions to ventilations, we're going to let him know that either a partner or a bystander shows up with an AED. He would verbalize to us that he would have somebody take over compressions and ventilations. So either a partner, somebody else who's trained to do CPR while he gets the AED ready for the patient. Okay, so go ahead and
So at this point, your
Bring
partner
the-
will route you your
Yes.
AED. And you will turn on your AED, follow its prompts, so it'll give you directions on exactly how to use it.
Apply pads to
somebody
patient's
would be
bare
doing
chest.
compressions and ventilations if he had a
Plug
partner
in
on scene.
pads connector next to flashing light.
And your pads have on them a diagram that shows you exactly where to place them on your patient.
Apply pads. Plug in connector. Analyzing heart rhythm. Do not touch the patient.
So we're going to make sure that nobody's touching the patient. Whoever was doing compressions,
Shock
ventilations,
advised.
they're not touching anything that's
Charging.
touching the patient, because we want the
Stay
AED to
clear
only
of
analyze the patient.
Deliver shock now. Press the orange button now.
So you make sure everybody's clear of the patient. So say clear, and then you'll deliver the shock.
Shock delivered. Paused. Begin CPR.
And you'll resume CPR.
So then we would begin another 2-minute cycle of 30 compressions to 2 ventilations. The AD is going to remain on, and it will analyze about every 2 minutes. And that is the end of your cardiac arrest management with AED skill sheet.